Right now, something dangerous could be happening inside your body. Your kidneys may be slowly losing their ability to filter your blood, and you may feel absolutely nothing. No pain, no warning, no obvious symptom. That is the terrifying truth about kidney disease. It can destroy kidney function silently for years. Doctors often see patients whose kidneys have already lost more than 70 or even 80% of their function before they realize something is wrong. By that point, the damage may already be permanent. But the body does try to warn you, not always through pain, sometimes through something much easier to overlook. Your skin, a strange itch that refuses to stop. Skin that becomes unusually dry, dark patches appearing without explanation, puffiness around the eyes that never fully disappears. Most people ignore these signs. They blame weather. They blame stress. They blame aging. But sometimes these changes are early warning signals that your kidneys are under serious stress. In this video, we will reveal 7 silent skin warning signs of kidney disease. These are signs doctors often see long before kidney failure occurs. If you notice them early, you may have a chance to protect your kidneys before irreversible damage develops. So watch carefully, because one of these warning signs might already be appearing on your skin right now. Sign number 1, persistent itching that has no clear cause. One of the earliest skin symptoms linked to kidney disease is persistent itching. This is not the kind of itching caused by an insect bite or dry weather. This itching can feel deep and intense. Many people describe it as a crawling or burning sensation under the skin. It may appear on the arms, back, chest, or scalp. And the strange part is this: often there is no rash at all, no redness, no visible reason, but the itching keeps returning. This happens because healthy kidneys remove waste products from the blood every minute. When kidney function declines, these toxins begin to accumulate in the bloodstream. Some of these waste chemicals irritate nerve endings in the skin. At the same time, kidney disease disrupts the balance of minerals like calcium and phosphorus. This can lead to tiny deposits forming in the skin that trigger itching even more. Doctors call this condition uremic pruritus, and it affects many people with chronic kidney disease. If you experience persistent itching without a clear cause, especially if it becomes worse at night, it is a warning sign worth investigating. But itching is only the beginning. There is another skin change that many people overlook completely. Sign number 2, extremely dry skin that lotion cannot fix. Dry skin is common, but kidney-related dry skin is different. It is more severe, more persistent, and ordinary moisturizers often do not solve the problem. People with declining kidney function frequently notice their skin becoming rough, flaky, and dull. Sometimes the skin feels tight or cracked. This happens because the kidneys help regulate fluid balance throughout the body. When kidney function declines, the body's ability to maintain normal hydration changes. Sweat glands and oil glands may also become less active. Without enough natural oils and moisture, the skin begins to dry out. But there is another problem. When toxins accumulate in the bloodstream, they can interfere with the normal process of skin renewal. Old skin cells remain longer on the surface. The result is skin that appears chronically dry and unhealthy. If your skin suddenly becomes extremely dry and does not improve with normal care, it may be worth considering whether your kidneys are functioning properly. And the next warning sign may be even more noticeable. Sign number 3, darkening of the skin. Another subtle signal of kidney disease is unusual skin darkening. This change may appear gradually. Many people notice darker skin on the face, hands, or neck. Sometimes the color becomes grayish, brown, or slightly bronze. This happens because damaged kidneys cannot properly remove certain pigments and waste products from the blood. One of these pigments is called urochrome. Normally, it is filtered out through urine. But when kidney function declines, these substances remain in circulation. Over time, they can affect skin color. Kidney disease can also stimulate increased production of melanin, the pigment responsible for skin tone. The result is gradual darkening that many people assume is caused by sun exposure. But when pigmentation changes appear without explanation, it can be a sign that toxins are building up in the blood. And sometimes the skin becomes not darker but paler. Sign number 4. Pale or yellowish skin. Healthy skin has a natural color that reflects good circulation and oxygen delivery. But kidney disease can change that. Many people with declining kidney function develop skin that looks pale, dull, or yellowish. One major reason is anemia. Healthy kidneys produce a hormone called erythropoietin. This hormone tells the bone marrow to produce red blood cells. When kidneys become damaged, this hormone production drops. The body begins producing fewer red blood cells. As oxygen delivery to tissues decreases, the skin begins to lose its healthy tone. The result is a complexion that appears tired, pale, or slightly yellow. Many people think they simply look fatigued. But in reality, the body may be struggling with reduced red blood cell production. And there is another visible change that often appears around the eyes. Sign number 5. Persistent puffiness around the eyes. The skin around the eyes is extremely delicate. Because of this, it is often one of the first places where kidney problems become visible. People with kidney disease frequently notice puffiness or swelling around the eyes, especially in the morning. This happens when damaged kidneys allow protein to leak into the urine. Doctors call this condition proteinuria. Protein plays an important role in maintaining fluid balance in the bloodstream. When protein levels drop, fluid begins leaking into surrounding tissues. The thin skin around the eyes shows this change quickly. You may wake up with swollen eyelids, or notice puffiness that remains throughout the day. Many people blame lack of sleep. Others assume allergies are the cause. But persistent puffiness around the eyes should never be ignored, because sometimes it is the body's way of signaling that kidney filtration is weakening. But there is an even more unusual skin symptom that can appear in advanced kidney disease. Sign number 6. White powder or crystals on the skin. In severe kidney failure, the body reaches a dangerous stage. The kidneys can no longer remove enough waste products from the bloodstream. When this happens, the body attempts to eliminate toxins through the skin. One rare but striking symptom is called uremic frost. This appears as a thin white powder or crystal-like layer on the skin. It forms when urea, a waste product normally removed in urine, is released through sweat. When sweat evaporates, it leaves behind tiny urea crystals. Although this symptom is uncommon, it is a clear sign that kidney function has become severely compromised. When it appears, immediate medical care is required. But before kidney disease reaches that stage, there is another warning sign that may appear on the skin. Sign number 7. Unusual skin rashes or thickened skin. Kidney disease can also cause changes in skin texture and structure. Some people develop small bumps. Others notice red or irritated patches. In certain cases, areas of skin may become thickened or hardened. This happens because kidney failure disrupts many systems in the body. Mineral balance becomes unstable. Inflammation increases. Blood vessels may become damaged. In rare cases, kidney disease can cause a serious condition called calciphylaxis. In this disorder, calcium deposits form inside small blood vessels in the skin. This can lead to painful skin lesions and tissue damage. Although rare, it shows how deeply kidney health affects the entire body. Why these signs matter. Your kidneys perform an enormous job every day. They filter about 180 liters of blood. They remove toxins, balance electrolytes, control blood pressure, and regulate fluid levels. When kidney function declines, waste products begin circulating throughout the body. These toxins affect many organs, but the skin often reveals the first visible clues. Unfortunately, chronic kidney disease often progresses quietly. Many people do not realize anything is wrong until kidney damage becomes severe. That is why recognizing these early warning signs can be extremely important. What you should do. Not every skin change means kidney disease. But if you notice several of these symptoms, it is wise to take them seriously, especially if you also experience fatigue, swelling in the legs, changes in urination, foamy urine, high blood pressure. Doctors can evaluate kidney health with simple tests. blood tests measuring creatinine, estimated glomerular filtration rate, known as eGFR, and urine tests that detect protein leakage. These tests can detect kidney problems long before severe damage occurs. Your skin is more than a protective layer. It is sometimes a warning system, a signal surface that reflects what is happening inside the body. Persistent itching, extreme dryness, darkening skin, puffiness around the eyes. These signs may appear small, but they can sometimes be early warnings of something serious. Kidney disease often develops silently, but the body does try to send signals. The question is whether we notice them in time, because protecting your kidneys today could protect your health for the rest of your life.